Charcot arthropathy is a type of arthritis that patients with neuropathy can develop. Neuropathy just means that our nerves aren't working normally. So nerves are nothing more than electrical wires running in the foot. And just like a regular wire that frays, that starts to short circuit, that can happen in the body too. And as those nerves short circuit, the body perceives it different ways. Sometimes that can be numbness, tingling, sometimes that's pain, lack of sensation. As those nerves stop working, our body's ability to respond to normal things goes down. If you or I are normally walking and we step on a little rock and our ankle twists, our muscles sense that because of the nerves and our foot corrects itself. In patients with neuropathy, that doesn't happen. And what that leads to is lots of little traumas over time that lead to the destruction of these joints. The joints in the foot can become unstable, and just like a straw that breaks the camel's back, there can be an event that leads to the entire foot dislocating. The entire foot structure can fall apart. In patients without neuropathy, that would be extraordinarily painful, and we would know what was going on, that there was a problem. But a lot of our patients with neuropathy, they don't know because they can't feel their foot, and so they can have a terrible problem that really just doesn't hurt. The problem, though, is with that deformity, it can lead to pressure and skin breakdown. As our skin breaks down and we start to get ulcers, that's how infection can then enter the body. Once infection sets in, it creates a very big problem. Data shows that patients with Charcot actually have a 10% chance of ending up with an amputation in their lifetime just because of having Charcot. If you have Charcot with an ulcer, your amputation rate goes to 50%. And so our goal at Campbell Clinic is to intervene early, to stabilize these deformities before they go on to getting breakdown of the skin. We want to keep you active and keep you taking steps. And the way to do that in cases of Charcot is often with surgical intervention. The most common causes of neuropathy, by far and away, is diabetes. Diabetes leads to inflammation in our body where our body starts to attack our own nerves, and that's what leads to the neuropathy. But diabetes isn't the only cause. The second most common cause is what we call idiopathic, meaning we don't know. We can go through all sorts of workups to try and look for other causes like vitamin B12 deficiency, chronic alcoholism, syphilis. There are lots of other conditions that can cause neuropathy, but the most common cause is diabetes, and the second most common cause is just we don't know, or sometimes referred to as age-related neuropathy. Anybody that has altered sensation of their foot has to look at their foot every day. You need to have a mirror in your bathroom set on the ground so you can hold up your foot and look at the bottom of your foot every day. Many patients with diabetes actually have affected vision, and so their vision isn't normal. If you can't feel your foot and you can't see well, you need to have somebody else that you know and trust help you look at your feet every day. Things to look out for are redness, swelling, calluses, or any sign of the skin starting to break down. Those are reasons you really need to see one of us at Campbell Clinic very soon. With Charcot, it really comes down to early interventions, not just surgically, but also non-surgically. In all of my patients with diabetes, we're examining their feet at least every 6 months to a year and getting them into appropriate footwear. When we can't feel our feet, we need to make sure the things that touch our feet are safe. And so getting them into special diabetic inserts for their shoes that support the skin, that support and stabilize the foot can be helpful. There are situations where as the deformity starts to set in, you can intervene early with special types of casts and being non-weight bearing or not walking on the foot for a period of time. And sometimes that can delay and stabilize the deformity without needing to go on to surgery. But it requires frequent follow-up and letting us take a look at things and taking very frequent x-rays, because this is a problem where once it starts to give out and lead to an unstable deformity, the chance of amputation goes up very significantly. The surgery for this is big surgery. We go in and we correct big underlying deformities, and we take out bones that are dislocated and leading to pressure in the foot. We then stabilize the foot with a lot of hardware that's underneath the skin. There are metal screws that go inside the bones of the foot the entire way of the foot, kind of like rebar in concrete. And on top of that, we then put plates and screws over top to stabilize everything. We then close up all of the skin over top of that, and patients are then immobilized or in a cast for about 10 to 12 weeks after this sort of procedure. After that, we're able to start walking on it again with special diabetic type shoes and are able to get back into our regular activities. There are risks. Anytime you do surgery, there's risks of bleeding, infection, and wound healing. Those risks are certainly higher in patients that have neuropathy and diabetes. However, when we're looking at an amputation rate of 50% with a lot of these problems, those risks of surgery are lower. In many cases, the risks are lower with an operation than without an operation for Charcot. For patients with Charcot, again, it comes down to their underlying neuropathy. Because they have neuropathy, any joint that has the neuropathy can be affected. One can have neuropathy in the middle part of the foot and then be stabilized, and it is possible to then get neuropathy of the ankle above that. That can happen, and that's why all of our patients with Charcot, we follow them every 6 months to a year to make sure they're not getting any other problems. In the same way, we can have Charcot on one foot and it could develop on the other foot because neuropathy is really throughout our body. It's not just with one foot or the other.